Dallas area, doing a short talk on ADD and ADHD. We've done a little bit of an overview the last couple of lectures, talked about some of the standard care, which I think is falling short in detective work for what's causing the ADD, ADHD. So we want to find out what's causing the problem in the brain. So let's get into that. And it doesn't have to be a natural approach. I kind of throw around the let's do natural medicine because I'm for finding things that are not harmful long term for improving health. And those things that are not harmful are generally foods, food supplements, vitamins, minerals, diet changing, things like that. So that's the things I accept into my body long term. I don't want to do prescription drugs in my body long term. But all that set aside, we just want to be a good detective to try to find out what's triggering the problem in the brain. The problem rarely originates in the brain. It's usually a chemical problem, but don't forget, some kids or adults may have some just emotional stress. There may be something going on in the life that's causing some stress, and you react. So you need to look into, is there some, what's the environment? Is there something that's, a life situation, stress for the child or adult that's just causing you to be, feel a little bit emotionally or mentally crazy? And if you can handle that, then things can calm down. But I find that the gigantic chunk of the problem is a chemical problem for most people. So again, not looking at the brain as the problem, but the brain is an area that's having a symptom. Where could the problem be coming from? The first problem that is the most common one, if you get anything out of this video, remember this, is food allergies. So food allergies can trigger a lot of problems in people's stomachs, can cause inflammation in joints, it can cause people to feel fatigued, and it can cause a lot of problems in the brain. You think of a food allergy as, maybe some stomach discomfort, and true, you do have some stomach discomfort or symptoms there from foods, but foods very commonly trigger problems in the brain. Headaches, trouble focusing, anxiety, trouble sleeping, hormone shifts. These food allergies are real problems for a lot of people. And when a child or adult has ADD, ADHD, you want to try to find out if there's a food allergy involved, because if it is, avoid that food and watch symptoms calm down. So having a test done for food allergies is vital, and that's one of the first things that I do for anybody that has this problem. As I go, okay, you have this problem, let's do some testing to see what might be behind the problem. Food allergies is the number one thing behind the problem. Number two thing that I find is toxins. Generally, people get toxins in the body if they have an exposure to something that's really bad all of a sudden, like I drank some poison, surge in toxins in the body. That's rare. It's more often that there's like a slow exposure and kind of a slow buildup of toxins, and you can't detoxify fast enough to keep up with it. We all have different genetic abilities to detox. There's some people that seem like they can eat trash, eat bad food, and they have no health problems. Those people usually detoxify very, very well. And then on the other end of the spectrum, you have people that don't detoxify so well, so they can be around some mild toxins in the environment, like we all are, but you're not detoxing very well. And if you don't detox very well, the toxins kind of accumulate, builds up to a certain point, and the brain starts having symptoms, or other places as well. So the approach would be try to improve the detoxing ability of the body. Support the liver, support the kidneys. Maybe take some stuff that assists with pulling some of the toxins out of the storage places in the body. So also another thing I wanted to just throw into the mix is vaccines. There are a lot of correlations between vaccines and brain problems later. So if you look at the ingredients about what's in vaccines, it's a long, long list of weird stuff. And so when you get that injected into your body, especially at a young age, look at what happens to kids about a week later. There is a huge body of evidence showing that brain problems can start post-vaccine vaccination. So what do you do about that? If it's already done, it's done. But what can you do? Usually that involves detoxing, trying to do massive detoxing over some time to get some toxins out of the body. So you need to do some testing to see if there are toxins present. There's a lot of tests that can pick up on that. And then, yes, if it's present, let's start doing some support for getting those toxins out. Simple. So you don't, if there's a knife in your shoulder, ow, what do you want to do about it? You want to pull the knife out and let it heal. You don't want to have the knife in your shoulder, ow, and then just take some pills to numb the pain. That's in essence what's going on with some of the medical approach, is there's like a knife in your brain, if you can picture that, and then you're like, the brain's kind of crazy and reacting, so let's take some pills to make your brain sleepy so it doesn't mind the knife in the brain. You want to just pull it out, let the thing heal, and the knife is very often the food allergies or the toxins. So you need to just get that irritation out, let the brain get back down to normal. So another thing that can be involved, sometimes there's 3 or 4 problems that are involved, is low-grade infections. So yeast problems usually occur in the small intestine, large intestine, a little overgrowth of some yeast, sometimes some microparasites. These low-grade infections produce chemicals and toxins that are inflammatory. These can get into circulation in the body, and where does it get circulated to? Sometimes the brain. So sometimes the brain is having reactions to the chemicals produced by dysbiosis or infections that are in the stomach. Yes, stomach in general. So sometimes part of the puzzle for getting someone fully better is to clean out any low-grade infections that are creating mischief, increasing inflammation, and causing brain reactions. Now, that's another thing that needs to be done, but that is usually not the main one. Usually the main one I find is foods or toxins. You also may need to have a little bit of some nutrition that you need a little bit more of than the average person. There's genetic variations on how much chromium one person needs or how much zinc one person needs. If you look at the average, you might say, well, I need 7 milligrams of this thing. But what about the people who are on the other ends? Like, I don't need very much or I need a lot. So your child or you may be one of the ones that need a lot. And if you're not getting that, you think I'm just doing the average, you may not be getting enough of what you need. Genetic variations, people may need a little extra of a nutrient. And that nutrient may be important for the brain or the function of the body. So testing on, are you low on some vitamins or minerals, is also very, very important. So that's another test that needs to be done. So a little summary over what needs to be done for ADD, ADHD. We need to do some detective work as to the causes. I don't care about the ADD, ADHD. I don't care about that label. I very care about what's the cause behind it. So I want you or your child to feel great. And for that, I want to find out what's causing the problem. I don't want to just treat the symptom. The symptom is, behavior problems or trouble focusing. Okay, let's find out what's causing the brain to be irritated. Just keep that in mind. I don't want to treat the symptoms. I want to treat the cause of the symptoms. And that usually is food allergies, inability to detoxify optimally, maybe some hidden infections, and some nutrient deficiencies. Those are the biggies. Call my office if you're interested in scheduling an exam. My phone number is 972-880-8541. Ask me questions here if you want. You can comment down below. Subscribe to the channel if you're interested in learning more stuff. I'll be putting out some videos regularly on different topics. That's in a nutshell of what needs to be done. We need to do some testing for what's behind things, and then once we find what's behind things, we'll work on it. And then you'll see some shifting in the symptoms, and hopefully getting people better and better. I'll see you on another video series. Hope to hear your comments or questions, and I'll see you on another video.